All right. Hello, classmates. Today we're going to be learning about Dorothy Johnson and the behavioral systems model. That is a nursing theory that is used. So first, let's go through a little bit of history on Dorothy Johnson. She was born in Savannah, Georgia, graduated from nursing school in 1938, received her BSN from Vanderbilt University in 1942, and proceeded to get her MPH from Harvard in 1948. She served as faculty for nursing schools in both Vanderbilt and for the University of California. She has been influenced by Florence Nightingale's beliefs that nursing's goal is to help individuals prevent or recover from disease or injury, with the focus being placed on the patient rather than a specific disease. So focusing on the patient's behaviors, their signs and symptoms, rather than the diagnosis being given. Treating symptoms before diagnosis that's given by a doctor or whatever. So moving on, Johnson's behavioral system model. It's developed roots in the works of many behavioral scientists in psychology, sociology, and ethnology. The goal of nursing for this model is that the behavioral system model being to maintain or restore behavioral system balance. Her model presents the client as a living and open system in which the body is a collection of behavioral subsystems, and they interrelate to form a behavioral system. And because these systems are linked, a disturbance in one of these systems will likely cause an effect on another system. An example of this would be like homeostasis. Just when you create a disturbance, there's going to be this balance that's interrupted and can cause issues. Johnson proposed that there are 7 subsystems that exist, which in order are achievement, affiliative, aggressive, dependence, sexual, eliminative, and ingestive. And each of these subsystems consists of 4 elements. 1 being a drive or a goal, 2 a set, 3 a choice, and 4 an action or behavior. And this is where the key elements are here. If you look at these images, it kind of displays what's going on with these. So for a drive or a goal is their motivation or reason, as I'm describing the 4 elements of each of these subsets. A set is ordinary or normal behaviors a patient prefers to use to meet their goal. So this is the behavior they're going to use to meet that drive or goal. Choice are options that are available for the patient to meet their goals. So can they make this decision? What options do they have to meet their goal? And action is the final element, and that is the consequence of the last 3 components. Did they reach their goal? Did they cause issues? Did they not meet their goal because of this? Each of these subsystems has a function. So for achievement, it's to control or master an aspect of self or environment to achieve a standard. For affiliative, it forms the basis for social organization. Its consequences are social inclusion, intimacy, and the formation and maintenance of strong social bonds. For aggression, it's to protect and preserve the system, so protecting the person themselves. Dependency is helping or nurturing behaviors with consequences including approval, recognition, and physical assistance. For the sexual subsystem, it's for procreation and gratification. It includes development of gender identity, and gender role behaviors. Eliminative is what, when, and under what conditions we eliminate excretion, urination, defecation, etc. And ingestive, when, how, what, how much, and under what conditions that we eat. So for our nursing meta paradigm, for nursing, according to Johnson, nursing is an external regulatory force that acts to preserve the organization and integrity of the patient's behavior at an optimal level under the conditions in which the behavior constitutes a threat to physical or social health or in which illness is found. The behavioral system is to facilitate restoration, maintenance, or attainment of behavioral system balance and stability. Basically, what this is getting at is that using external regulatory forces is getting at what interventions are we going to provide to balance these patient behaviors so that they aren't hurting themselves, or how we can change their behaviors to have them help themselves, per se. Focusing on the person is viewed as a biological being, as a behavioral system with the 7 subsystems of behavior. According to this model, the role of medicine is to focus on the biological system, and the role of nursing is to focus on the behavioral system. For the environment includes both internal and external environments that are not part of the individual's behavioral system, but influence the system. Strong environmental forces disturb the balance of the behavioral system and threaten its stability. These internal and external environments could include illness being an internal environment. It's not directly a part of that person's behavior, but is definitely going to affect it. The same with external environments. Are you in a situation that you feel uncomfortable in, or something like that? For health, Johnson refers to both physical and social health in defining the health meta paradigm. According to Johnson, health is determined by the interaction of psychological, social, biological, and physiological factors. Efficient and effective functioning of the system that results in a behavioral system, balance, instability, is equivalent to a state of health. Illness, in contrast, is defined as a behavioral system imbalance and instability. The application of this framework starts with assessment. The assessment begins when IQ or tension is observed that signals disequilibrium. And if we go back to this slide here, we can see that on these, on the start of this circle, on this blue picture here, we have a stressor that is causing us to move through this circle. During the assessment phase, the nurse is going to obtain data about the nature of the behavioral functioning related to goal attainment. The nurse also obtains data related to client behavior. Indicating whether the behavior is purposeful, orderly, and predictable is also important. The nurse then interviews the client and family to assess the condition of the subsystem structural component and assess the client's behavior for behavioral system balance and stability. An example of this would be asking family members if this is the way the patient normally acts. If, say, there's a cognitive impairment in the family member or something like that, there isn't really, there is an issue, but maybe that issue is already being dealt with in a different way. So it's not the highest priority on our list at that moment. Then we're moving on to diagnosis. Based on the assessment, a good example of this diagnosis can be seen in the article in table 1.1. For example, there it's showing as their diagnosis for this theory, they're using insufficiency or dominance in most of the diagnoses, meaning they're not behaving as they should to help themselves with their treatment. And we'll get into this article later as well and explain that in more detail. Then we move on to planning. Using our assessment, we plan a course of action to help retain or continue the maintenance of the behavioral system, structure, balance, and stability. Using implementation, we're going to have goals for management of nursing problems. We are to restore, maintain, or attain the client's behavioral system balance and stability, and to help the client achieve an optimal level of balance and functioning. So really, we are just trying to help push them towards this behavior that helps them in their own health. And with evaluation, we're going to evaluate the behavioral system balance and stability the same way we do our assessment. We're going to be, asking the patient questions. And after that's accomplished, the nurse compares the client's behavior after treatment to indicate the behavioral system balance and stability. And we're going to document these changes. So for a case study example, using Johnson's behavioral model on our book on page 86 of the nursing theory textbook, we're doing an assessment on a diabetic male, or it might be female, I apologize. And with this assessment, if we go in and read this, we have the patient is eating in excess more than they should be. And that's the subsystem that we are going to try and help fix, or per se, help the patient fix themselves with their behaviors. So the subsystem being affected there is obviously going to be our ingestive. And with the 4 structural components, the drive or a goal, a set, a choice, an action or behavior, the patient hasn't been decreasing their cholesterol intake or their food intake of sugars and such items. So therefore, their goal isn't being met because their drive, their set, and their choices are not helping them move that way. So I believe one of the suggested interactions in the book was to restrict dietary guidelines for this patient, which would change their choices and probably change their drive and set, and then their action would change to a more positive consequence rather than a negative consequence. And then with this, we're going to also move on to our diagnosis, planning, implementation, and evaluation. Because again, finding those subsets are a part of the assessment. So with this theory in practice and in evidence-based practice, there's a case study by Askar, I hope I'm saying that correctly, I apologize if I'm not, and Selva Ezgi. This study was done in Turkey of the behavioral system models with a patient with coronary artery disease. With the nursing process of Johnson's behavioral model, the affiliative system, the function, this patient was living at home with her husband and son. Her married son does not spend time with his wife, children, and since accompanies the mother here. Her daughter-in-law did not call her throughout the last hospitalization, and this is making our patient upset. Our patient is not going outside, has fears because she suffers from diseases in her family history and thinking that her own outcome would also be bad like theirs, and stating that she has sleepless nights without any reason. To change this with her planning and application, we try and change the environment a little bit, maybe get assistance and support for the son to change the stresses there, encouraging her to talk to her daughter-in-law, maybe do some physical activity before bed or non-tiring activities, as to not stress her coronary artery disease. Talking about her thoughts about death and these issues might also be therapeutic. Then moving on to dependence, providing self-care, suffering from shortness of breath while dealing with household chores. Being a plan and application could be that she is provided support for these household chores or trained to take breaks and suggested to take breaks. Again, changing the behavior to help the patient. Moving on to the aggressive, she's been unable to finish household chores and gets tired of guests her husband is inviting to the home. She states that her husband is constantly smoking next door, even though herself does not smoke, and that she is encouraged to talk to her husband about these situations and maybe have a meeting with her husband about the necessity of trying to either at least stay away from her while he's smoking or smoking cessation possibly. With ingestive, she's not following her specific diet for diabetes and hypertension. She's not seeing a diabetic nurse because she also has a comorbidity of diabetes as well, not just the coronary artery disease, as typically coronary artery disease has other comorbidities that go along with it. She's only eating 2 meals a day without having irregular eating habits, without eating any snacks, and this is due to her husband and son and not willing to cook multiple times a day, just 2 meals for everyone and eating these meals. So that's another reason why she's not eating a diabetic specific diet either. So obviously some applications for this and planning would be meeting with a diabetic nurse or provider, regulating a nutritionist, using nutritionist, the importance of monitoring blood glucose and blood pressure might also be a possibility as well. The eliminative, the patient has no problem urinating, maybe had a little constipation the past couple days. Again, moving to the planning and application side, if bowel movements continue to not be happening, checking up with a doctor, eating more fibrous foods, etc. The sexual subset was not assessed in this study. And achievement, though, having difficulty in doing household chores, not able to check the blood glucose and blood pressure often. She's having trouble following up on her drugs and taking them herself. She also expressed that she could not realize her own in the hospital and thinking that she was imposing a burden to her married son. She's the inability to sleep well. And so again, moving on to the planning and application steps, she gets support for her household chores. She is informed about the importance of monitoring blood glucose and blood pressure. Her knowledge on the subject is questioned and her lack of knowledge is met. So they help educate the patient as well. And since she provides self-care, this is maintained, her positive behaviors are supported. Stress associated with concerns and fears she feels are explained to her. And stress and coping methods are taught to her as well. So obviously, with these outcomes and all of the planning and applications that I just listed, they used on this patient and led to more positive outcomes just by behavioral changes the patient had made, using the skills taught to them. So with that, I just have my references and sources there. And I believe that's everything for the behavioral systems model. by Dorothy Johnson. All right.